I'm Lauren for FindMyDentist.com, and today I'll be covering proper brushing techniques for adults and for children. The first technique that I'm going to go over is the adult brushing technique that is recommended to most patients. It's called the Modified Bass technique, and it's very easy to use with people who have good dexterity. I'll be demonstrating on this model with an adult-sized toothbrush. You can also use this technique with a power toothbrush. The only difference is that instead of using the vibratory motions with your hands, you merely let the toothbrush sit on the affected area. To start, we'll want to move the toothbrush in a consistent sequence. You will start with the right back teeth on the upper arch called the maxillary arch. You will want to hold this brush at a 45-degree angle to the tooth surface that you are about to brush. In doing so, you contact the tooth surface, and the bristles also stimulate the gum tissue, which increases the blood supply to the gingiva. You'll want to hold the brush on a specific area for at least 10 seconds before progressing. After you're done brushing this area for 10 seconds, you merely do a small sweep to dislodge the debris downward before moving on. You'll repeat this for the entire arch. Once you reach the end of this maxillary arch, you want to go over to the lingual side and brush those surfaces as well. Now, when you get to the most anterior teeth, the front teeth, on the lingual surface, you want to tilt the brush vertically so that you can best access those areas and remove the debris. You finish the lingual arch. The lingual side of the arch. And what you have left is the occlusal, or the biting surfaces of the teeth, which probably need the most care because they come in contact with food most often, and food gets trapped in the small pits and fissures of these surfaces. So what you will do is you will brush those separately, and you just place the toothbrush on the occlusal surface. You repeat the same sequence for the lower arch, starting on the lower left side and working away to the right side, repeating for the lingual, and then also doing the occlusal surfaces. That's adult brushing technique in a nutshell. Another thing that's most important to remember is that for the majority of adults, you will want to have a toothbrush with soft bristles or ultra soft bristles. Hard bristles are not good for the teeth. Soft bristles still do remove a lot of deposit. The last technique that I'm going to demonstrate is called the Fones technique. It was invented by Dr. Alfred C. Fones, who was one of the first practicing dentists in the United States. And this is a technique that was devised for children. It's easy to use, it'll make brushing fun and efficient, and it is performed most effectively with a child-sized toothbrush that contains smaller bristles and oftentimes a longer handle to make it easier for children to reach the teeth. Now, the Fones technique is different because it involves both arches at the same time, and what you'll want to teach children to do is to move in the same sequence as you would for the adult technique, but to place the brush in the midline of both teeth, and then to rotate the brush in large circles on both sides, so it encompasses both arches, the gingiva, and the teeth. You still want to hold the brush at 10 seconds per area and to move in the same sequence along the arch as you progress. Once you reach the end of the arch, you would also go back and you would do the lingual of the arches separately. So this is similar to the adult brushing technique because you would need to have the jaw open as you brush those lingual surfaces, and that's very, very important because food does become trapped in those areas as well. To do the lingual surfaces of the anterior teeth, you would still tilt the brush vertically and do small sweeps until you dislodge and effectively clean those areas. Children will also want to use a brush with soft bristles. There's a lot of styles available for children to use, which makes brushing more fun. There are even automatic toothbrushes that emit sounds so that children know that they've been brushing for long enough. Regardless of the age, adults and children both will want to brush their teeth for 2 minutes at a time. This is the time needed to effectively dislodge plaque from the area. Plaque needs to be agitated for a certain amount of time before it can be removed from the tooth surfaces. And as always, you will want to supplement a brushing routine with flossing as well. I'm Laura for FindMyDentist.com, and it's been a pleasure to bring you proper brushing techniques for adults and for children.